Yesterday night, Jusuf Nurkic fractured his right wrist in a game against the Indiana Pacers. This is quite unfortunate given that he was out with a broken leg pretty much all of last year. Let's talk about his broken wrist injury in more detail. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. Be sure to subscribe to my channel if you want to stay up to date on future videos that I release. For now, let's get back to talking about the wrist injury. So actually on replay footage, when I looked at the actual injury that Jusuf suffered, it wasn't an actual fall or a large force that had caused a broken wrist. And this is why this injury was so strange. So it's this drive that he's trying to essentially intercept with his right hand, which causes him to kind of grasp it right after. And you'll see, so he tries to intercept this drive to the net, and this is where he immediately grabs his hand. You're not able to see it too clearly because his back is to us or the camera. And he still tries to stay in the play and blocks this pass here, particularly with his left hand. So you'll see he's actually really protecting this right hand. So because he was injured, he really used the left hand here to break his fall. And initially when you look at the replay footage, people thought that this was the instance where he hurt his right wrist. But when you rewind it back, he had actually hurt it trying to block that drive to the net just prior to it. Reports have come out and said, okay, Nurkic has suffered from a right wrist fracture. They haven't actually identified what type of fracture or whether or not he would need surgery. So usually when people say they suffered from a wrist fracture, they're actually talking about a fracture in either the ulna bone or the radius bone. You have actually a series of 8+ bones that actually sit in the actual wrist joint. But usually in a wrist fracture, it's the lower bones, the ulna and the radius, which are implicated in the fracture. So this is looking at the hand from the back as it's facing down. And this is your radius bone. This is your ulna bone. And as you can see, if I zoom out, they go all the way up to your elbow. So if we go back in, these guys here are called the carpal bones. And we don't typically see a ton of fractures in this area, especially when we're talking about a fall and an outstretched hand. While reports haven't identified what bones were fractured, my suspicion is that he likely hurt either the radius or ulna. Those are the most common injuries to see. The only carpal bone that we have to be really worried about is something called the scaphoid bone. And this one is this here. It is one that's implicated a lot when you fall on an outstretched hand. So when we're worried about a fracture, or whether or not it's operative, for example, we ask ourselves a few different things. Number one, is it displaced? What does that mean? Is the bone still in alignment, or does it come off to the side? We've seen other injuries on my channel where the bone is completely tilted, and you can even see that on the replay footage. If it's not displaced, usually you can actually cast them and keep them immobilized while the bone reheals itself or creates scar tissue. Now, if it is displaced, that's when you'll either need to, 1, try to get it back into place, or 2, depending on the type of fracture, surgery may be warranted. And that's where you're sending your patients to an orthopedic surgeon, where they'll put plates and screws, we call it hardware essentially, and then put them in a cast. And the last thing that you're looking for is damage to surrounding structures. So compromised nerves or blood vessels. If you see any of that in your examination, that's an automatic surgical emergency because you're going to want to make sure that nerve function and blood vessel function is restored. So let's take a look at a few x-rays that show examples of common wrist fractures that we will see. So a Colles fracture we see actually a lot more commonly, and it's when the back of the wrist gets displaced upwards. So if we look at the lateral projection, which is taking an x-ray this way, this is your radius and ulna, and as you can see, instead of going straight, this thing kicks off that way, so it's angulated this way. And if you look at it head on, so if you take an x-ray this way, you may not be able to appreciate it as much, although you can definitely see here, you can see some irregularities. It's really on this projection where you see that angulation, which brings me to my next point. You always have to get multiple x-rays of different views to make sure that you can see the bones in a 3D space. So what does this mean for Jusuf? Unfortunately, at this time, we don't actually know what bones were broken and whether or not surgery is indicated. Wrist fractures tend to heal a little bit quicker than something like a leg fracture, which he sustained in 2019. Usually bones start to form scar tissue at about kind of 4 to 6 weeks, and about 6 to 8 weeks, that's when it starts to remodel and build that strength back in there. Now, depending on whether or not he needs surgery or if he could just be casted, he could be looking at maybe 2 to 3 months off and coming back into the season afterwards. Unfortunately, I can't really tell you more of a clear-cut timeline because we don't have any more information about his injury. Now, if you like this video, please click on the like button. If you want to see more videos in the future where I break down sporting injuries so that an average fan can better understand them, please subscribe to my channel. For now, that's all.